So you say nothing's working for me. You tell me to take this medicine, then you tell me to take that medicine. Then you tell me, try this, try that. That's working, that's not working. Do this, do that. I'm trying. I truly am trying. I'm trying to work with the doctors. I'm trying to work with the social workers. I'm trying to work with the nutritionists. I just need y'all to work with me or talk with me or sit with me sometimes. You know, you ever been thirsty, doctor? Because you look thirsty. All right. You tell me to drink this little bit of water, 32 ounces, and all of this. I tried the frozen grapes. I tried a little bit of this. I tried a little bit of everything. And it's just rough and it's just hard. And you just don't understand. You're on the other side of this. You're not on the machine. You don't have to live being on this machine. You don't have to be tortured on this machine. You just don't understand. But if you ever sat over here, you get me. I'm telling you, you would actually get me. Okay? You know why? Because this is the Lisa Baxter Show, giving you the 411 in a kidney world. And you know I'm going to give it to you. Hello, hello, hello. How is everybody doing on this nice hot day? Your sister is sweating. Okay, so welcome to the Lisa Baxter Show. I got a great, fantabulous show for you today. All right, so listen in, tune in, and look, and make sure you share this, okay? And make sure you learn something from it. All right. Now, this is who I have on the show. I love this person. This person is a good person. She was very good to me when I was on dialysis. So let me introduce her before I start running off at my mouth. This young lady name is Maria Gonzalez. Maria Gonzalez is a registered, you get me, registered, somebody qualified, registered and certified dietitian nutritionist for Fresenius, for the Fresenius dialysis centers. I met her at one, but I hear she works at another. So I introduce her right now, and I am so glad to have her. I had her in the past on the Lisa Baxter Show, but on this particular network, this is her first time. Hey, Maria, what's going on, girl?
Hey, Lisa, thanks for having me.
All
Always
the
a pleasure.
time. All the time. You know I'm always glad to have you. You know I'm always glad to have you. You
Thank
my
you, thank
girl.
you, thank you.
How's life treating you, all right?
Very good. Can't complain. Everything's going well.
Oh, I know that's right. I know that's right. Now, okay, we're gonna start with a little bit of our background. Okay. Now you and I, you were my nutritionist when I was at South Queens dialysis, if it's all right to say. And I say you took very good care of me. You worked very well with me. You had the best recipes I've ever had. All right. I not only did I take them home and use them, I shared them with dialysis patients, non-dialysis patients, put them on Facebook. I did everything. I gave them out at the church. The people kept saying, "Where you get these from?" I said, "It's my secret friend." No, I'm just kidding. No, I told them that I got them from a great nutritionist at the dialysis center who gave them to me and who shares with all of us. So it gives us flavor and give us a chance to be able to eat well and to eat better, and what have you. So I do thank you for that. Coming around to my chair while I'm having treatment, sitting with me. I was able to either sit in your office, and you also, we talked outside of that, through the unit and around the center. So, you was in tune with us, I would say. Some people are not in tune. You were in tune. So I thank you so much for all the care you gave me, Maria.
My pleasure. It was my pleasure. Uh,
Okay, well, I'm glad, and we got the introductions in. So I would ask you, what would you say the definition of a nutritionist or a definition of, someone in your field? What would you say the definition of what you do? Give us a definition about what you do.
a nutritionist, dietitian, as we're called, is somebody who studies, food science and how it relates, and also, but with an understanding of the physiology of the body and how the body um, uses food and different disease states and how to manage disease states, with certain diets. So it's really like a food science kind of thing.
Wow. And I never heard it put that way. You said food science?
Yeah, you learn a lot about food science and how foods and different macronutrients affect different diseases. So, we just try to help people, whatever the case may be, whether it be kidney disease, high blood pressure, diabetes, try to, help them find the things that they can eat to help
Mhm.
keep their, maintain their health as best as possible.
Wow, wow. So, what made you get into this field, would you say?
From an early age, I always was around food. I was always, hanging around the kitchen in my house with my
Mm.
grandmother and my mother. So always around food, and it was like the next progression to
Oh, okay.
really go into nutrition. I've always been into health and sports and stuff like that, and it just, things kind of fell into place, and I feel like I was kind of led there.
Wow,
So,
wow.
and I
Well,
really
that's
like,
good.
yeah.
That's good to know. So it came down from your mother and your grandmother who was cooking in the kitchen. You were standing around. Was you cooking too, or did you help?
Of course, yeah,
That's good.
yeah.
That's good. So, all right. So you had a love for food, and you wanted to, I guess, help people to learn how to eat better and balance. Okay.
Absolutely, yeah, yeah. How to manage their health, how to be the healthiest part. How to be the healthiest they could be. Yeah.
Well, I know that you're into sports and everything, and I've seen you do sporting events and even sporting things to raise kidney awareness. Now, could you tell us a little bit about that if you don't mind?
Sure. A couple of years ago, we did, a triathlon. They have different organizations that sponsor people for triathlons, and we
Uh-huh.
actually NephroCure sponsored us, uh,
Hmm.
and they try to raise awareness about glomerular nephritis.
Hmm.
And so they sponsored myself and another coworker in the New York City Triathlon.
Wow.
So we did that, yeah. So just to try to raise money and awareness for that disease, and it was a really fun time. And it's good to always raise awareness and raise, money for research to help further research, to help cure some of these conditions can be cured. That's the hope.
Wow. Oh, okay. All right. All right. So how many years did you do that, or how long did you do it?
I'm still doing triathlons.
Okay.
I haven't really done it for that particular organization.
Oh, you went to
Anymore.
another one.
Yeah,
Mhm.
sometimes yeah, it depends. Different races have different sponsors, so yeah. So yeah.
Oh, okay. So I seen you training hard for it. I mean, you had to give some things up. I saw you running around drinking your water. Not that you don't do that, but I saw you doing a little bit more than usual.
Yeah, well, I had to learn how to swim, so that was the first problem.
Okay.
Yeah, prior to that, I really wasn't a big swimmer, so yeah, so I had to get in the pool and and just learn different skills and really practice, and
Mm.
it was good to push myself and to for a good cause, to really face some challenges, just and
Yeah.
just like a lot of our friends and patients do, they face challenges and they kind of get through them, and that's just the training for a triathlon was kind of easy compared to a lot of what our friends go through, so yeah.
Wow. I love that comparison. So you knew we had our struggle. So you had to have a struggle to do this, to raise the money and to raise the awareness. What was the name of the both of those organizations that you did this? Because maybe somebody out there want to do the triathlon, or maybe they want to give money to it or run that race.
Hmm.
So
Nephrocure. That's
Nephro Cure,
yeah.
the first one,
Oh, excuse me.
you said you did two different ones.
Yeah,
Nephro
and then
Cure.
the second one I did for a different so I have a love for animals too. So the second one
Uh-huh.
I raised money for the ASPCA.
Oh, uh-huh. Oh, okay. All right.
Yeah,
Very nice.
yeah. But the
Very
first one I
nice.
did was for Nephrocure. Yeah, Nephrocure.
Okay.
Yeah.
All right. So I'm gonna switch a little bit and ask you about patients and their diet. What
Mm.
would you say? What was your main target? What you have to do to help the patients and to get better with their diet?
I really, I really think, trying to help patients understand why we have to restrict certain things for, for end stage kidney disease and even for, the earlier stages of kidney disease, just
Mm.
helping them to eat the right foods. In dialysis, we're looking at higher protein diet, getting enough calories, also watching those things like phosphorus and potassium, things that can do some harm to patients that are harmful to patients on dialysis, help them to manage that the best that we
Ah,
can. through diet.
Okay. So I'm gonna take me through something when I'm gonna throw some things at you as far as okay, when you say phosphorus,
Mhm.
uh, tell me some things about why is phosphorus harmful, and or what would you tell them or recommend them to have or to eat or something like that.
So phosphorus is a mineral found in most foods. It's in every most all foods. It's
Right.
particularly high in dairy products. Like cheese, milk,
Well,
yogurts,
yeah.
ice cream.
Oh yeah, I read that
Yeah.
on the back of the label. Yeah.
Yeah, nuts and beans and although it's not as absorbed as much in those foods, but especially the dairy products and a lot of the processed foods are higher in phosphorus additives. So
Mm,
what that can do is the excess phosphorus, usually with normal kidney function, your body just gets rid of what you don't need and you don't even think about it. But with kidney disease, what happens is the phosphorus can't be removed so well, so we have to kind of limit how much you're taking in, and
mm,
that can be difficult because we have most of our food supply has a lot of phosphorus. So we're always working with patients in their labs and seeing what we can do more of or less of,
yeah.
to get their levels in range. And a buildup of phosphorus in the blood, it you can't really feel it or see it, but it causes calcifications, and that's what we're trying to avoid.
What's calcification?
It turns tissue into hard, like bony type thing. It makes
Mm,
tissues hard, and when tissues
wow.
are hard, like soft tissues, like heart tissue and stuff like that. So when those
Yeah.
things are turned hard, that can really create a problem health wise. That can
Okay.
cause the dysfunction of certain organs. Yeah.
Also, so this phosphorus can affect their organs, more organs, not just the kidneys are already affected because he's sitting on the machine, but this can affect more organs.
Yeah, it can affect your heart. It can affect your soft tissues. It can affect
Yes.
your joints, your bones. It
Mm.
really does quite a bit. Can really wreak havoc on quite a few things. So we always try to keep that in check. Yeah,
Oh, okay. All right.
yeah,
All right. So you go over this with the patients and you talk to them about it.
yeah. That's a
Okay.
large majority of a lot of my counseling with patients because it really is in everything, and it
Yeah.
can be difficult to reduce. So but a lot of patients are very successful with it. Just take
Yeah.
like you were always very successful. So it's so it's a matter of really, unfortunately, sacrificing some of the things that you want to eat all the time. Moderation
Yeah.
is really, I always tell patients that
Yeah.
moderation
All
is
right.
the key. Is the key.
That's so true. That's so true. I
Yeah.
was disciplined. I had to discipline myself, and that's not always easy. But in anything you do, you have to discipline yourself and balance.
Yes.
And balance.
Yeah. Yeah.
Now, when it comes to fluid, now talk about fluid. What is some problems about fluid, and what is some things you do to help them deal with fluid overload?
Okay, so fluid, we really have to reduce fluid because again, your kidneys aren't working, so you're really not, producing a lot of urine to get the extra fluid out. So
Yeah.
we have to reduce fluid, but that, we have to reduce things that make us want to drink fluid, and a lot of times that's salt,
Salt.
right?
Yes. Hmm.
So really, watching like those really salty foods, fast foods or processed foods, or using the salt shaker on foods,
Right.
yeah,
Yeah.
none of this.
Mhm. None of that. Yeah. Right. Yeah.
So not if you're making a recipe and you're using a small amount of salt, that's kind of spread out throughout the meal. But we're talking about really put it, how sometimes
Putting
people,
it on your plate kind of thing.
yeah,
That's a
yeah,
no-no.
right. Yeah. So that can make you thirsty. So we try to help people not have so much of that. And having extra fluid in your body can cause increases in blood pressure. You know,
Okay.
and that's not good. So
No,
your blood
not at
pressure's
all.
higher, then you're making your heart work harder, and that's never good. And
Wow.
it can be hard to take off all that fluid. So we try to really help patients to stick to about 32 ounces per day, depending on their output. It's we kind of have this general kind of diet advice. We really
Yeah.
we really tailor it to the person, right? Because everybody's a little different. Like you may not
Thank you.
have had trouble with fluid, whereas somebody does, or somebody might have you might have had issues with phosphorus. So if it's not broke, we don't fix it.
Okay. So you deal with them according to the person.
You
You meet
have
the
to.
person where they are.
Yes, yes. You
That's
have.
very important.
Yeah.
That's because people have different struggles. That's so true.
Yeah.
People have different struggles.
Right. And some people do better with, some people don't have to watch phosphorus as much. They might have some residual. So, you know, each person is individual, so we have to really tailor that kind of diet to each person. But
Okay.
we have those general rules which we're talking about today.
Okay. All right. All right. Well, the fluid, I know sometimes people have to be on a respirator because they have so much fluid overload, they can't hardly
Mm.
breathe or walk or anything like that. What do you do to help them with thirst? I know you had gave me some pointers, but I'm gonna let you say it, here and now.
Yeah, some of the good ones are to put grapes or strawberries or some bowls of watermelon in the freezer and take them
Uh-huh.
out a little at a time to kind of just help wet your whistle a little bit. Uh,
Yeah.
Using smaller cups, obviously. Try not to drink too much in between meals. Also, sometimes we say using like brushing your teeth or using mints, just to kind of keep your
Oh,
mouth uh,
moist. Mm,
moist. Yeah,
yeah. Oh, okay. Okay. I know chewing gum too, right?
yeah. Chewing gum, whatever works for you. Like I have certain
Yeah.
patients that find chewing gum very helpful. Other patients prefer like a little ice chip, or they prefer the fruit in the freezer, or maybe sometimes they'll take a piece of lemon just to get
Uh-huh.
that that
That,
kind of
that,
sour taste. Yeah,
oh,
yeah,
yeah.
yeah,
Oh, okay. All right. So that could work.
yeah.
So because we need the tips out there. I'm sure we need those tips out there. We're going to always need those tips. All right. So I know you have to spread the water throughout the day as well. Now, what about potassium? Potassium is a bad baby. So tell us a little bit about the potassium in the food and how it can be, reduced or what have you.
So potassium is another mineral found in foods. That one's found mostly in fruits and vegetables.
Mm-hmm.
And unfortunately, it's in people's most favorite fruits and vegetables.
Sure.
It's in bananas, it's in cantaloupe, it's in cassava, it's in mango, like in higher amounts.
Wow.
So, when some of our favorite, what we call vegetables, like potatoes,
Mm-hmm. Yeah.
peppers, things like that, different squashes. All fruit and vegetables have potassium, so we kind of tell patients to really limit the higher ones. If you're going to
Okay.
have a banana, have a small banana or a half a banana a couple
Yeah.
of times a week, right? If you want to have a potato, maybe a half a cup, here and there. Moderation again is your key.
Yeah.
And then there's ways of dialyzing some of those higher potassium vegetables.
Yes.
Yeah, so you can find some good instruction online if you go to National Kidney Foundation and search, dialyzing vegetables. There's some very good. It doesn't take all the potassium out, but it does reduce it so that you can, enjoy that a little more frequently. And then it's based on your lab work. If your potassium is running high, obviously you'd want to be more strict with what you're taking in.
Oh yeah, yeah. If
Yeah,
my anything was high, my punishment was I couldn't have it. You know what I mean? I had to normalize myself
right.
first. You know.
Yeah, yeah.
You know.
Yeah,
But
and it can happen. We all go to special events. We kind of overdo it. So
vacation.
exactly. So
Yeah.
and dialysis patients and kidney patients have to be, it's a lot of
Oh,
work. They have to be more mindful of that because the potassium, what it does is can affect the heartbeat. So we don't want that. So we don't want that heart to
wow.
be regular. So so
So it
that's
throws
why.
the rhythm off.
Yeah, yeah.
Wow.
Send you to the hospital. Yeah. So we
Woo.
always try to tell patients, to watch those things, and that's why we take blood work, to make sure and to help people realize the importance of that and
Yeah.
how we can moderate the diet so that they can include these things, but just not maybe as excessively as we used to
Yeah,
before
because
that.
we used to soak the potatoes overnight. Because
Yeah,
like 6 of my siblings were on dialysis, so we had to be very careful in the holiday season making a potato salad and stuff. You had to soak them overnight,
yeah,
basically.
exactly. Yeah.
So,
Soak them
oh,
overnight,
okay.
throw away the water, boil them again, throw away the water,
All
and
kind of
then
stuff.
yeah.
Yeah. Yeah. Tell them those tricks now. Tell them what they got to do, you know. Now, you also gave out the report card. Sometimes you would go over the report card with me. You sat with me and you talked to me about the report card. If I had any questions, I went to you. If I didn't understand something, I didn't know anything.
Hmm.
So, talk about the report card. Why the report card?
So we take lab work every month, to kind of get a picture of how things are in your blood, whether your levels are high, low, good. There's plenty of that too, but plenty of people do very well, and they don't have it high or low, so that's always good. And we just go through those indicators, their albumin, which is their protein levels, which is very important for
Yes, say
patients.
that.
Yeah, potassium, phosphorus, calcium, parathyroid. We kind of go over all that and just
Oh
review
yeah,
it
the
every month.
PTA. Yeah.
Yeah, just to help people kind of rein it in, or tell them that they're doing a great job and to continue doing what they're doing. So it's just a snapshot of what's going on, and it's
Wow. Well,
useful.
you had helped me with that too because I had to get the operation on the throat because the parathyroid
That's right.
went wild, and I
Mm-hmm.
couldn't get that thing lowered down. It started affecting my bones. I was in pain all the time. So if you out there listening, know about that. I tried to run from that operation. I just couldn't. I tried and it went to 4,000. I went from 200. I tried to keep it into that range to something to it shot all the way to 400. I couldn't get it down. The pills wasn't working. I was throwing them up. So I thank you for helping me with that. I was successful after that surgery. But nobody wants to be cut. Nobody wants surgery, but
Yeah.
sometimes you just don't have no other way. And that's why I went that way. But I talked to you first, right? We had to kick it first, right?
Yeah.
Going over that report card and telling me what I had to do. So I do thank you for that. What would you say what is one of your success cases that you've done or been in this journey of this excellent job of you have?
Well, you're one of my best success
Oh,
stories.
uh, uh,
You've done so much. To see you, to just continue, even after your transplant and everything, and just continue to raise awareness and be an advocate and stay involved. And so you're one of my best success stories.
Aw.
Um, but there are there's a number of them. It just you know
Excuse
I
me, hold it. Say that again. You don't hear too many places brag about patients or their patients. You said there are many of them. Say
Yes,
that
there
again.
are. Yeah,
Mhm.
there are.
Wow.
It's you know, patients come in. Listen, people they've been through a lot, and their kidneys have failed. They're in dialysis, and you just try to encourage them to do the best that they can. And
Oh yeah.
what's really rewarding, and I see it in so many patients, is when they really start to feel better. After a
Mhm.
couple of weeks, a couple of months, they really start to feel better and start to really feel themselves again. You see the twinkle in their eye again, and
Oh, okay.
and that's really the most rewarding. And that's just not from dietitians. That's from nursing. That's from all the care that
The whole team.
the whole team. Yeah,
All right. All
absolutely.
right.
Yeah. So I'm just a piece in the puzzle, and
Yeah.
and you see you just see it every day, and it's always wonderful to see.
Yeah, it is. It is. And I'm glad you're seeing it. You know what I mean? I'm
Yeah.
glad you're seeing it. I saw some of it as the advocate. So what was your hardest case, would you say, or toughest case? Because I know there's tough ones out there too.
Yeah, there's tough cases out there. I gotta say, like, having patients really resistant to any kind of, help, or really seeing, you know, um, I guess seeing the importance, especially from my end, the nutrition end.
Yeah.
Seeing the importance of that, and just having to really be patient and just continuing to work with them, and just
Mhm.
accept what they take away from it, and hope that they continue to stay open to it. And
Mhm.
so there's some tough ones. But you never give up on anybody. That's always been my thing, is you never give up on anybody, because you never
Mhm.
know when they're going to hear what it is they need to hear to kind of turn it around. And,
Wow. Yeah. Oh yeah.
so
Is any part of this job that you didn't cover, or I didn't say anything about part of what you do, or your definition, or how your day is going there? Is it any part that you would like to say, or
Well, we talked a lot about nutrition, and this. At the end of the day, I get to meet a whole bunch of people, and I get to know a whole bunch of people, and really get to know them as people, not just as patients. You get to
Mm,
know about families. You get to know about life events, and you go through a lot of things with patients, and that's really, besides the nutrition stuff, that's the cool stuff too. Is every day I get to talk to people,
yeah.
and that's always good, and it's always very rewarding.
Mm.
Say, so that part, that makes, and then you see people do well, and get transplants, go on, and it's just really a great thing. Yeah.
Wow. Now that's good. Now that's what I'm talking about. And you want to hear those kind of stories because people tell a negative all the time. That's so easy. You can come up with a negative story. Say what? You say positive. You got to scratch your head. You got to think a little bit. You
Yeah.
know, if there was another person out there about to think about taking this kind of job, dealing with our population, what advice would you give him or her?
Um, that's a good question. I would just, to to newer dietitians or people coming into, I would just, uh, just to continue to want, build relationships with patients, and meet them where they
Mhm.
are, and just help them on their, on their journey, and um, yeah, and just to be patient, and not so judgmental, because people are
Okay.
really going through a lot. So
Mm.
try to reserve, we try to just stay open, and just to be patient, and get to know the patients, really.
Wow. Get
Yeah.
to know him.
Yeah, absolutely. You got to get to know people, right?
So build your relationship with them is very important.
Ah, that's
Get to know them.
keys.
Mhm,
Absolutely. Yeah.
mhm.
Yeah,
All
because
right.
we're talking about real personal stuff. We're not just, we're talking about food, but the struggles people have with food, aside from
Yeah.
their kidney disease, right? I mean, that's, sometimes that's really hard to talk about with a stranger. So, we
Yeah.
want to know people. Yeah.
Yeah.
And that's
Why
what
I'm
we
stuffing my face? You're talking to me. I'm just kidding. But you don't know where people are. When they're on there.
Yeah. Yeah.
So
You don't know
that's
what
good.
they've been through. Yeah, absolutely.
Well, at least you care to know that. Now, if you had to say something to a patient that's out there that's not listening, that's not conforming to the nutrition or the diet, whether they're a new patient or a patient that's seasoned and just don't want to hear it, what would you say?
Yeah. Um, you know, I tend to gently remind people, to about why I'm telling them, because I care. And I think sometimes people forget. They think, oh, you're just doing, you're just telling me what I need to say because it's on the paper. And you know, and it's really, yeah, it's on the paper, and it's my job. But at the end of the day, I really care about you. I want to see you healthy. I want to see you not, do as best as you can on dialysis, so that you can remain healthy enough to hopefully get a transplant. And that's really what I continue to do. And some people, still don't want to hear it, but I go back every week.
So they got to see you and they got to put up with you, whether they
Yeah,
want to hear it or not.
yeah.
Yeah.
So
Well, you probably use humor because you need that. A merry heart doeth good like a medicine. I'm sure you're using humor to help you. Anything to get you sliding to that home plate, right? I know
yes,
that's right.
yeah. I use the humor, and sometimes, like me and you, we used to just talk, not
That's true.
always about food.
That's right. We
Yeah,
just talked about any and everything.
talk about life, right? We're just
That's
people.
right.
Yeah, yeah.
Yeah. And you didn't mind. Some people are closed mouth. Some people don't. They want to keep it business so you made it friendly. You know what I mean?
I try.
You made it like you want to be friendly. Some people are not friendly.
Yeah.
Patient or staff. So, it can go both ways.
Yes, it can. Yeah,
I'm glad it went the way it went.
yeah.
I'm
Right.
very glad it went the way it went.
Yeah.
So well, is there anybody you would like to give a shout out to? A family member or the staff at the spot or the place or I don't know, somebody. Somebody you're
Always
proud
gotta
of or
always
something.
gotta give a shout out to mom.
Oh, I like that now. Go mommy, that's right. Give that shout out to mom.
Yeah, yeah. But thank you for having me. It's always a pleasure, and thank you for doing what you continue to do all the time, every single day, and all the events that you go to, and that just keep raising awareness and keep getting people involved. It's really great. It's good
Wow.
to see. Yeah,
Thank you.
yeah.
Well, you keep doing what you do as well. And I'm very proud of you as well. And I thank you for not only coming on the show, I thank you for doing your job and going beyond your job. Because you could have just handed me the paper and kept it moving. But no, you're gonna sit next to me and all of that, start talking to me and everything. So and all of that. And I still got that pocketbook. Thank you.
No,
I
it
get
was
great
much
reviews on that
better,
pocketbook.
wasn't it?
What?
Yes.
I had to beat people off so they don't try to take that pocketbook. That pocketbook was slamming. Thank you. So thank you for that. And thank you for coming on. And you be well, you be blessed. Make sure you together for the triathlon and send me a picture or something and let me know how you did. I'm sure you're going to swim all the way through it. Watch out for the sharks.
Oh, thank you, Lisa. Thank you so much.
You're welcome and have a great night.
All
And
right.
thank you.
Thank you.
Bye-bye.
Bye.
Well, guys, this is it. This is the end of the show, but I'm glad you stayed in. See, there's a way you can have a relationship with the people in the dialysis center. All relationships aren't rotten, terrible, or bad. I'm not saying none weren't, but this one was a good one, and you can have a good one too. So thank you for tuning in. I believe to see you next week, or you'll see me next week. And this is your girl giving you the 411 saying, God bless, good night, and keep it good. All right? Eat right. Peace.